In this video, we're going to go through all the thigh and lower leg muscles. When you're doing this, just like with the arm, you got to make sure you orient everything correctly. Obviously, you can't see the bottom of the leg here, but your toes are going to be anterior. But what most people screw up is the lateral versus the medial. So this is the pubis bone right here. So make sure you know that that is medial, and then this is lateral. So again, orient front and back, and then orient medial and lateral. And I will use those as we go through this practice video. Let's start on the lateral side, and here you have the tensor fasciae latae, and that is the muscle, and then you have this band that comes down, and that is called the fasciae latae. More commonly called the iliotibial band or iliotibial tract. You'll also hear it called the IT band when you're in a physical therapy, athletic training kind of situation. But for this class, you're going to know it as the fasciae latae. Then we come over here and we have your quadricep muscles. Again, this is where you don't want to screw up. Here's your medial side. So this is called the vastus medialis. The center muscle is called the rectus femoris. And then over here on the lateral side, you have the vastus lateralis. The vastus intermedius is deep to the rectus femoris, so you're not going to see it on many of the models. The muscle that comes across from lateral to medial is called the sartorius. The most medial muscle on the inside of the leg is called the gracilis. And then there's this muscle that's deep to the gracilis called the adductor magnus. And when you're looking at the model, you can not only see it on this side, you can also see it on the opposite side of the gracilis. It runs below it. The last muscle we have is the adductor longus. And you can't see it here, but that adductor longus runs deep, and again it's long, so it's going to go underneath there and attach towards the knee. So that is the adductor longus. So again, one more time on this picture, we have the tensor fasciae latae, and you have the fasciae latae, which is this connective tissue. We have the vastus medialis, we have the rectus femoris, vastus lateralis, sartorius, gracilis, adductor magnus, and adductor longus. Now if we look at the posterior leg, we have the superficial muscle, which most people don't ever miss, the gluteus maximus. Here we're looking at the vastus lateralis again. So again, you want to get your medial and lateral straightened out. Here's your medial, here's your lateral. So we're looking actually here at one of the quadricep muscles. Then we have these three muscles here, which make up the hamstring. The most lateral is called the biceps femoris. Comes down here. You can actually feel this tendon behind your knee. Then we have the semitendinosus right here. And then deep tendinosis, and you can see part of it sticking out here and part of it here. That is the semimembranosus. Right, that is the semimembranosus. Here you see the other portion of that adductor magnus. And again, most medial, you have the gracilis. So again, vastus lateralis, you're looking at part of the quadriceps. You have the biceps femoris. You have the semitendinosus, which is superficial to the semimembranosus. You have the adductor magnus, the gracilis, and up here in the butt you have the gluteus maximus. Now if we take the gluteus maximus off, you can see some of the other butt muscles. Here you have the gluteus maximus, which has been cut. Here you have the gluteus medius, which is located near that top of the iliac spine. Okay. Up here, the iliac crest, I should say. Right here is the gluteus medius by the iliac crest, which is represented right here. Again, the iliac crest. So you have the gluteus medius, that's where you want to get a shot. You don't want to get a shot in your maximus because of this thing sitting down here called the sciatic nerve. So if the needle accidentally hits that, you will go up and probably hit the ceiling in pain. So again, we have the gluteus maximus. We have the gluteus medius here by the iliac crest. Deep to that, we have the gluteus minimus, and then we have this muscle right here, which is called the piriformis muscle. It's one of the external rotators of the butt. Now this muscle, notice this sciatic nerve comes through here. This muscle tends to get tight in some athletes, especially runners, and what that can do is that can irritate that sciatic nerve. In a small percentage of the population, the sciatic nerve actually runs right through that piriformis. So one of the things athletes, especially runners, have to do is make sure they keep that piriformis stretched out. So again, we have the gluteus maximus, gluteus medius up by the iliac crest, the gluteus minimus, and then the piriformis muscle. The last group I want to show you up here by the hip and thigh is the iliopsoas. The iliopsoas is actually a group of 3 muscles, 2 of which you need to know. This is, again, we're looking at an anterior view now of the torso with all the organs taken out. This is the psoas major. There is a psoas minor, but you don't need to know it. This is the psoas major. This is the iliacus, which again, this is your iliac crest up here, so this is the iliacus. And again, together they make up the what's called the iliopsoas muscle. This tends to get tight in people also and can be a cause of low back pain if it gets real tight. The lower leg muscles, again, we're looking at the posterior. Make sure you don't get your medial and lateral mixed up. Remember, your little toe is going to be lateral and your big toe here is going to be medial. So this is going to be the gastrocnemius that attaches to the calcaneus through the calcaneal tendon. Also attaching there is the soleus, which is this flat muscle. It looks like a solefish. When you take it out, it's a flat muscle, so that's where it got its name. Okay, that's where it's got its name. And here we have, and again, this case we're on the lateral side. So if you think about the bone that's on the lateral side, it's going to be the fibularis longus. Okay, the fibularis longus on the lateral side. And then in the front, here's your anterior view. You have the tibialis anterior. Here's your tibia, so tibialis, and then it's in the front of the leg. That is the tibialis anterior. Okay, the tibialis anterior. Let's go back again through these. Okay. This is the tensor fasciae latae, the muscle, and this is the fasciae latae, which is connective tissue. This is the vastus medialis, the rectus femoris, and the vastus lateralis. Over here on the medial side, we have the gracilis. We have the adductor magnus, which is deep. We have the adductor longus, and then we have the sartorius, which goes from lateral to medial. In the posterior leg, we can see the vastus lateralis. You've got the gluteus maximus. The 3 hamstring muscles include the biceps femoris. Here we have the semitendinosus, and running deep to that, we have the semimembranosus. We can also see the gracilis on the medial side, and again we can see the adductor magnus deep to that gracilis. Here's your gluteus maximus. Here's your gluteus medius up by the iliac crest. Deep to that maximus you have the gluteus minimus. And then here, one of the external rotators is the piriformis muscle. Looking anteriorly into the torso, deep muscles, you have the psoas major, and you have a minor, which you don't have to know, but you also have the iliacus along this iliac crest. Together, these are called the iliopsoas muscles. In the lower leg, we have the gastrocnemius. We have the soleus with both attached to the calcaneus through the calcaneal tendon. Here we are on the lateral side, so we have, again, the fibula is lateral, so you have the fibularis longus. You see it here, and also on the lateral side here. In the front, with the tibia, you have the tibialis anterior. One more time, a little bit faster. The tensor fasciae latae, the fasciae latae, the vastus medialis, the rectus femoris, the vastus lateralis. Underneath the rectus femoris is the vastus intermedius. Gracilis, medial, adductor magnus, adductor longus, sartorius. Here we see the vastus lateralis, gluteus maximus, the three hamstring muscles, the biceps femoris, which is lateral, the semitendinosus, deep to that is the semimembranosus, the adductor magnus, and again most medial, the gracilis. Gluteus maximus, cut away, gluteus medius by the iliac crest, gluteus minimus, deep, piriformis, also deep. The psoas major, the iliacus, and together they make up the iliopsoas. Go ahead, review these, make sure you take the practice test and that you're comfortable with the spelling of these names.